Hello everyone. I'd like to introduce myself. My name is Mohsen Iskander. I'm consultant obstetrician and urogynecologist in Southport and Ormskirk Hospital in United Kingdom. And I would like to talk to you about the forthcoming course in Urogynecology in Dubai, but I will ask my colleague to introduce himself first.
Thank you, Mohsen. So my name is Dudley Robinson. I'm a consultant urogynecologist and honorary senior lecturer at King's College Hospital in South East London. And it's my great pleasure on behalf of the two of us to invite you to join us for the Urogynecology course run by IBC here in Dubai. So the course consists of a series of didactic lectures covering the important aspects of female pelvic floor dysfunction. So we'll be giving lectures on overactive bladder, stress urinary incontinence, conservative management, surgical management, and also management of all forms of pelvic floor dysfunction, including the perineal repair. We'll also support that by really helpful, useful hands-on sessions, again looking at different aspects of pelvic floor dysfunction, and I'm sure Mohsen will elaborate on that further.
We put a lot of emphasis on the workshops in this urogynecology course. So apart from the lectures, we give every day of the course there will be workshops. The workshops will include training on injectables, urethral injectables or bulking agents such as Bulkamid, which a procedure that can successfully treat stress incontinence, and you can do it as an office procedure. We give you training on the injection of Botox in the bladder in cases of overactive bladder and urgency incontinence. There will be workshops on tapes and the insertion of mid-urethral tapes, retropubic and transobturator for stress incontinence. There will be a workshop in teaching you procedures to manage vault prolapse, such as sacrospinous fixation using a Capio device. There will be workshops on insertion of pessaries for prolapse, as well as other workshops which Dudley is going to talk about as well.
So in the forthcoming course in October, we hope to bring in new workshops, again focusing on the treatment of refractory overactive bladder with botulinum toxin, also posterior tibial nerve stimulation and sacral neuromodulation as well, to give us much more practical hands-on experience of demonstrating those procedures.
The course is suitable to a general gynecologist to attend, as well as gynecologists who have interest in urogynecology, but also obstetricians who practice mainly obstetrics will find the course very useful, because as you know that a lot of pelvic floor dysfunction occur because of multiparity and following childbirth, and that is why the course will cover a lot of areas such as sexual dysfunction in women, such as vaginal plastic surgery and rejuvenation, and also the repair of third and fourth degree tear in model, and we teach you how to do this properly. So we strongly invite you to come and attend our course, which will take part in Dubai between 10th and 13th of October 2025.
So after the 3 days of the urogynecology course, we then have a specialized day looking at urodynamic investigations. So that will take you through the whole spectrum of urodynamic investigations, from uroflowmetry, simple cystometry, video urodynamics, ambulatory urodynamics, and also urethral pressure profilometry. And to support that, we'll be using helpful videos to demonstrate the techniques, as well as having a live demonstration with a laboratory urodynamic machine from Laborie. Throughout the course, we realize how important it is to interact, for you to ask questions, and to bring together discussions. So we'll also have a number of surgical videos, case presentations, and case discussions, which we would like to share with you throughout.
I would just like to invite you all to come hopefully and join us, and we hope to see you in October, and I'm sure that you will find the course in urogynecology and in urodynamics useful. And thank you very much.
So on behalf of Mohsen and myself, we look forward to seeing you in Dubai.